frustration generally comes. It's better let it die instead of having such kind of like. But there is no answer for that. At least the answer is something like somebody to sit and listen to them.
So, with your suggestion, I can we put dignity here in the study? Emotional. Yeah, I mean dignity cuts across all the domain.
Yeah.
For example, I think I can use one
Somebody as a branches.
Right. Because I think when that's when we go to you, I think you can admit and put the dignity in the center.
Yeah, in fact, you say like it can come even in the physical dignity.
Yes. So I think maybe that way we can keep the dignity in the center.
Perfect.
That's a wonderful suggestion. I learned something from it. Thank you. Now, the same thing, but we look at individual thing. Again, the dignity is not there, but we consider that dignity is in all cases. So there is a patient and there is the caregiver. There are ways that they are responding or they are coping with those things, and there are conflicts in these all areas. And there is a perception how this caregiver has perceived all those. When his perception, concern, values, beliefs, and expectations are always in play. Right? So, caregiving is not a single action, it is a complex reactive psychological and physical ecosystem that constantly balances activity with life resilience. This, I think I have not. We heard that my mind is troubled seeing the patient constantly. I always ask myself when this is end because I feel like I am in prison. Now, this sentence tells us that we need more detailed evaluation of the psychology of yes. Now this is India. I am not able to sleep getting 20 in the night and then waking up to the car. I have to get 45 minutes sleep, not easy. I just wanted to give some examples. Again, from India, I think psychology is stressed like thinking about this condition, and as the doctors have also told that I want to focus on that can be here also, I have mixed up the caregivers from the government in India. This illness requires more money because we are supposed to buy medications and treatments. It's difficult to get money because this illness requires more money than the amount we used to live. Now this tells us that we need some assessment of financial assessment is required more. Here again from India, I am not able to go anywhere out, not even to temple. I have stopped visiting my relatives, not in communication with them. All these issues of it means there is a single caregiver bottom by all those things. No personal time, no time to rejuvenate. Some was also saying that okay, if I come here, I think my mother 3 days there, and I go back and I take my mother. So I think those kind of cares when they can be provided at home, they will also have the time for rejuvenation. And when that all goes, then we know that finance is also there. 100% labor is done by the caregivers, exhaustion, emotional burnout goes, and the whole ecosystem collapses. That means that patient and the family member, but I additionally add, I think all of you will be providing that to them also. All of them needs to be otherwise the system will collapse. So an intervention in one quadrant will fail the rest of the cycle is. So as a caregiver, I think all of us will have a need, financial, practical aid, healthcare and information access and psychological support and all the technical aspects of the support which I have. So some of the things, you see what can be done is that at least there is a physical exhaustion, despite clearing the domestic aid, deploying family health nutrition providers, allowing primary care to be able to sleep. I mentioned the problem here, but so we do that here. Emotional trauma, keeping the family, not just the patient, is the primary responsibility of the therapy. And finally check regarding the cost of fundamental care agencies, hygiene, supply, resource security, supply,
Okay.
and transport to prevent assets slipping.
Okay.
In medical health business, clinical dedicated clinical time to train caregivers on basic symptoms of the transfer to caregiver. Now, these are taken. See, what key messages were India core and despite vastly different cultures, the structural burden and the psychosocial coping mechanisms of informal caregivers exhibit striking but universal. So that means all of us, all across the globe, caregivers have the same problem. So we are not the weird ones. See, sometimes we cannot see for 3 days and suddenly we become angry. One day with the client also. That doesn't make us a bad people because everybody experiences that. So to be kind to yourself at that particular moment. Which I have already highlighted, caregivers are also so concerned with caring for relatives' needs that they lose sight of their own dignity. And the last slide is a supported caregiver. I think we are here. All this training is here to make a network, referral system, change system, so that they will empower the caregiver. So a supported caregiver is the ultimate palliative care intervention. In closing thoughts, true palliative care intervention cannot be achieved by keeping the patient in isolation. Formal healthcare system must expand its mandate to protect family and follow the side of the system and access to some. So I think that in that context, all of you, when you go back, you will have to solve a lot of responsibility, a lot of fun, a lot of satisfaction, but a lot of fun. So these are the domains that you can assess. And when you actually go to the field, you start surveying that these are good short-term problem. So one is for caregiver identity, they will apply it to themselves. Like you get off the score, you will know how much how they need our help. Thank you for the questions. Thank you for patient listening and thank you for getting the question to that. Thank you.
First thing is, I can say everyone immediately is that one positive thing like today. The slides are more interesting.
Let me be clear about the slides. I read a lot of articles. I chose few of them. I made my own slides, but then after that I gave it to the AI. So you can see genuinely notebook.
Yes.
So thank you for allowing me to clarify that also.
So that was very nice. When you look into the slide, I'm a little bit more interested of how this, the animations and pictures are. What is going to be the next thing?
That's genuinely notebook. But I have to do a lot of editing also there.
So next question to you, sir, maybe to answer to the team. So as you said that take care of yourself, how do the nurses and the doctors or the palliative care professionals take care of? How do they do that?
Alright, that's a wonderful question. I'm so happy that this question has come because from yesterday when I was seeing everybody working here, the pace I saw everybody working and preparing for this, I want to worry. What about this team? Is this team taking care of themselves? Because I also heard that there is a crowd at 5 o'clock or 4 o'clock in the morning, that very patient.
He is the one. He is sitting there.
Yes.
Okay.
And when I heard that, I was happy about the dedication, but I was concerned about the self-care, about the team. So thank you for bringing this issue. See, the first thing is that, okay, let me give you an example. Suppose I am how to take care of it, right? Suppose if I am a tree, alright, and I am a wonderful tree. I have got a lot of knowledgeable tree. I have got a lot of mangoes. Whoever can pick up one, go, right? But have you ever noticed whoever takes the mango from me, whoever comes to share with me, nobody will water me. Because everybody thinks that I am a grown up tree. Does that make sense to you? But if I am not nurtured bottle apple, I will gradually shrink, yes? Yes or no? People are not going to see, people are going to see your previous version who was quite happy, all that, gave a lot of say, gave a lot of manuals to other people, right? And they begin to complain. Then you begin to think, what about all those things that I have done in the past? Now they will say, yeah, you did it in the past, but what about now? By the time this thing has happened, you have already lost your core ability. Many people come to me
अरू
and
मान्छे
say,
निकालेर एउटा फोटो खिच्नु न भने
"Straight. Let me know your
मलाई
inside
लाइफ
of this."
त्यही हो।
You know what I'm saying? So what is the nourishment for that mango tree?
यस्तो
It
पारे
needs to get a lot of sunshine.
यता हेर्नु
needs
यस्तो
to get
पारे
water into
न्युजको
it.
लागि भनेर
It has a lot of trees has to, the leaves has to fall within its surroundings so that it becomes manure for it. That's what it is. So what question? That's what absolutely. So what is the nourishment for us? How to take care of it? This is hard question. Third is his question. I'm just clarifying the question. I think for this group and for this team, what I can say is that all the things that we have been doing to another person as a priority, the first priority has to be when you wake up in the morning, you don't rush if there is not an emergency. When you wake up, right? You become aware, you become conscious that I'm awake. When you feel that I'm awake, you felt that you are awake. Last night, this morning when you were awake, very conscious that you were awake. I'm forgetting myself because I'm remembering the breakfast, but I'm forgetting. But I can go to the breakfast. Now we can go to the lunch. Can we go very consciously to the lunch? Yes, there is a lunch. I am walking. See, my attention is within myself. If I am speaking, can I speak consciously? If I am listening, can I speak consciously? So that I put the attention. So that watering is putting my attention within myself. Is my understanding. First condition for that person. If you want to take care of anything, your attention has to be there in the first place. If you want to take care of this, where your attention should be. If you don't need attention to this, you cannot take care of this. So self-care means the first condition is that your attention should be where? Where? In the future. First condition. And how do you put the manure? With good food. As long as possible, you maintain a good hygiene, sleep hygiene, eating good, eating habit. And suppose I say something very nasty and you don't like it, most of the time what we do? Emotional self, right? What we do? Ignore it, move on. These are the small cancer cells we are developing actually inside. And there are some research which says, which is related to this. I don't know this research level, I wouldn't like to comment in their presence. They know better about this, but recently I have come a lot of about. Why? Because when I have to negotiate in something which is not meant to value, part of me dies. And figuratively that becomes a seed of a cancer cell. But before it dies, can I do the comparative care to my cell, that small emotion that was happening to me? Can I just stand, take a long deep breath, or can I look into my own room and say, see, there is nobody for you, I'm there for you. If nobody understands me, I understand you. Trust me. How do I know? Hundreds of times. Right? That's the best answer that I
एउटा सबैको काम लाग्ने हो साइकेटिस्ट हाम्रो कामको सुरुमा हुन्छ
For example, as a doctor, being in an OPD or in your IT setup, whatever it is, then you have a lot of patients. There is a patient with an uncontrolled pain since 3 days. He is in suffering. There is another patient with no vomiting control. There is another patient who is breathless. Just imagine that these 3 patients are in front of you. It has been 3 days and your authority might be forcing you like what is happening, do something, take help of somebody, and even the nurses have been forced with a different, this patient comes with some file, they want to do this to the other. Don't you think that that's a mental pressure? At last you are exhausted physically, yes, and you are tired. Then taking the breaks is very important. When you are mentally not upset, see, remember, it's not easy that individuals can comfortably work in palliative care. I see thousands of nurses coming in, first day very happy, fresh, and at last, in a week or 10 days of time, they leave the program.
That is lack of self-care.
Exactly, lack of self-care. They don't know, like nobody can guide them, and they are not prepared. Not everybody can. Only thing is your self-preparation is important. Taking some breaks. If you are feeling a little bit uncomfortable being in that situation, take a break, go out, have a fresh air, come back for work. Charging the battery again.
In
And
all
also-
the consultations, there is a topic of safety netting. I think everybody is going to that.
Okay.
In that cases, it is taught to us, I think.
But still, sometimes we also have that kind of dementia. Most of the time, you listen to that. I'm talking about the educational dementia. You listen to all the sessions, you say that everything is perfect.
Safety netting is a housekeeping one. That's why you say, आफैलाई care गर्ने हामी
I will like to end this with one example. In between, when I went to the OPD, actually 3 BDS students were posted with me. So I had to teach them something. I said, I will not teach you anything particularly, tell me what you want to learn. Because I have to take 12, I was at class, so I have to go.
So, minimizing the work.
No, they asked me that. And I said, you see, okay, then I'll tell you, I'll demonstrate you something. I just said, you just look at me. Now also you look at me. Sorry, and I will be in a conversation. If there's nothing else you can do this. This is what I demonstrated. I saw few clients in their presence doing this. So can you ask me any random question? But I want all of you to focus on me here, what I do. And you can also do that. If you do that. Right? But notice one thing, my chest should not rise, my abdomen should rise. When I take a breath in, my abdomen should rise, not the chest. I'll demonstrate. Right? Right? Is my abdomen rising? This is chest breathing. This is chest breathing. I'm not asking for if that is a problem. That's the Now I'm breathing. It's very big, right? Can you all of us see it?
त्यहाँ यसरी समाउनु पछाडि हात देख्नु
You can also do, but keep on watching me. Sir will ask me the question, but you keep on watching me. How it is possible to do even in this setting like this? So can you focus on me, what I am doing? Throughout, even when I am listening to the question and answering the question, you take the feedback from sir whether he is listening. If I am communicating with you, it's very important that I do. Deal? Practical exam. So can you ask a random question?
So how was your day, sir? Is everything fine? See, yesterday was a very difficult time. So, did you experience that?
Thank you, sir, for the question.
But yesterday was very uncomfortable for me. His medicines did not work. And he is also coming and telling about management and it's very hard.
I learned that you had some difficulty with the builder and
Yeah,
the
no,
local
and
and
medicine
you
also
also
not
know. Were there any other thing that you experienced?
a lot of things from my side to say. Which is nothing is comfortable. Learn something else from that. Instead of doing the same.
Is there anything in particular in your mind that might be
There are, but as a doctor, maybe you may not deal with it.
I'm glad that you trust me. Which area do you want to focus on?
More of my physical pain, which is not been controlled for many days. I don't say this.
Thank you, sir. Now, did you see? I did stop doing my good breathing here. Did I? Did you feel this?
There was an attention.
So it's possible. It's possible. And my client's feedback is that the more I am doing it, they feel that they get understood better. If you do that, where should my first attention be? My first attention should be here. The more I am grounded, better I am. Practical demonstration. Sir is a respected person. If I listened and heard, if I being respected in the communication, I was engaged. What did I do? So, let's do the justice to the sir's last question, and this was an experimental question. And how do you take care? So can you go up to the lungs with the full awareness of how you are doing the lungs? You are eating the lungs. Can you fully enjoy the lungs? Rather than whatever thought comes, I'll attend to
बडे
it.
न्युजको लागि चाहिन्छ क्या
Can you just focus on the trimming of it? Because that way your attention is focused.
And म एउटा यो केयरगिभर सपोर्टको लागि हाम्रोमा चाहिँ मोस्ट अफ द जेरियाट्रिक पपुलेसन पेन्सनर सयजना देखिरहेको छ सबै केयरगिभरहरूलाई मन्थली ट्रेनिङहरू दिन्छ कसरी पेसेन्टलाई केयर गर्नु कस्तो इस्युज आयो भने हस्पिटल जानु त्यो पनि गर्छ त्यसको साथसाथै एउटा ग्रान्ट पनि दिएको छ त्यसले मोटिभेट गर्छ त्यस्तो छ अझै त्यो पनि पुग्दैन कि भनेर चाहिँ अहिले चाहिँ हामीले जुन 100जना छन् तिनीहरू घरमै जाने के छ त सिचुएसन कस्तो सपोर्ट दिनुपर्छ त्यस्तो चाहिँ प्लान गरिरहेको छ अनि त्यसको साथै अझै अति नै गाह्रो हुन्छ भनेर चाहिँ एउटा अथवा मेडिकल प्रोफेसनल हायर गर्छ त्यसलाई के गर्छ भनेर चाहिँ त्यो एकदमै गाह्रो कतिजनाको हुन्छ नि त तिमीले पैसा तिमीलाई पैसाहरू भन्नु भने त्यो चिजहरूलाई सबै यस्तो हामीले गर्दैछ
Thank you, sir.
Thank you. सबैभन्दा ठुलो कुरा केयरगिभरहरूलाई पहिलो कुरा चाहिँ त्यो आफू पनि केयर प्रोभाइडर हो र अन्य केयर प्रोभाइडरहरूलाई पनि डिस्ट्रेस हुन्छ भन्ने रियल
आज एकीकृत प्रशामक तथा हस्पी हेरचाह आधारभूत पक्ष सम्बन्धी बिपी प्रतिष्ठानले कोशी प्रदेश तालिम विकासमत परियोजना तथा आयोजक नेपाल हस्पी केयर सेन्टर र समन्वय बिपी केज विद्यार्थी अन्कोलोजी विटले आयोजना गरेको र यति बेला चाहिँ साइकेट्रिस्ट विभागका प्रमुख डाक्टर वैकुण्ठनाथ अधिकारी सरले आफ्नो क्लास सकाएर गइसक्नु भएको छ। त्यसै गरी क्रिस्ट शिक्षण अस्पतालका डाक्टर हुनुहुन्छ उहाँ चाहिँ क्यान्सर विशेषज्ञ हुनुहुन्छ विष्णु दत्त सर। त्यसै गरी बिपिकेएसका एनास्थेसियाका डाक्टर हुनुहुन्छ उहाँ हुनुहुन्छ बालकृष्ण भट्टराई र सबैले चाहिँ क्लास लिइसक्नु भएको छ र यहाँ चाहिँ कोशी प्रदेशभरिका ग्रामीण क्षेत्रमा कार्यरत नर्सहरू आउनु भएको छ। पाँचथर गाईघाट तप्लेजुङ र उर्लाबारी बाट पनि आउनु भएको छ र कतिजना चाहिँ धरानकै हुनुहुन्छ भने यता बिपी प्रतिष्ठान अन्कोलोजीका डाक्टर अभिषेक थपलिया सर पनि हुनुहुन्छ र अहिलेको क्लास चाहिँ सकिएको छ। र अब चाहिँ क्लास सकिएको छ। हुन्छ।